Brad Williams, Frugal Finance, disadvantages of Medicare Advantage plans. Medicare Advantage plans are becoming preferred choice for many beneficiaries due to their extensive coverage options, including prescription drugs, dental, vision, and hearing care, often at a lower cost than original Medicare. However, despite their appeal, these plans have notable limitations and drawbacks that individuals should consider before enrolling. Key considerations: while Medicare Advantage plans may be an attractive option due to lower premiums and additional benefits, they do come with a few downsides. Common drawbacks include difficulty switching plans, limited access to healthcare providers, restrictions on services, and unexpected costs for out-of-network care. Additionally, the geographical limitations on coverage may make these plans less suitable for individuals who frequently travel or have homes in multiple states. It is important to weigh these disadvantages against potential savings, especially for those on a tight budget or those eligible for special needs plans. By 2025, projections suggest that over half of Medicare recipients will be enrolled in Medicare Advantage. Medicare Advantage versus Original Medicare. Original Medicare offers a straightforward approach covering hospital, Part A, and medical, Part B services. However, it does not include prescription drug coverage or supplemental benefits like dental or vision care. Beneficiaries often opt for Medigap plans to fill the gap in coverage, such as coinsurance costs. In contrast, Medicare Advantage plans are designed to provide more comprehensive coverage by combining hospital, medical, and prescription drug coverage, along with potential extras like dental and vision care. However, they often come with limitations that Original Medicare does not impose. Features: Original Medicare, Medicare Advantage. Providers: Original Medicare, any doctor accepting Medicare. Medicare Advantage, limited to in-network providers. Care restriction: few. No pre-authorizations for Original Medicare. Medicare Advantage, pre-authorizations and referrals are often needed. Out-of-pocket maximum: no limit. Medicare Advantage, yes, annual cap on out-of-pocket expenses. Prescription drug coverage: separate Part D plans required. Medicare Advantage, typically included. Additional benefits: none. Medicare Advantage often includes dental, vision, and hearing. U.S. travel coverage for Original Medicare: yes, anywhere Medicare is accepted. Medicare Advantage, typically no coverage outside of network areas. Medigap compatibility: can purchase to cover extra expenses. Medicare Advantage, not compatible with Medigap. Original Medicare provides flexibility to visit any healthcare provider that accepts Medicare, but it comes with cost-sharing requirements such as a 20% coinsurance. Medigap plans can reduce these costs, but do not cover benefits like dental, vision, and hearing care. On the other hand, Medicare Advantage plans often bundle these benefits. They limit the choice of healthcare providers and may require additional approvals for some services. Disadvantages of Medicare Advantage plans: difficulty switching plans. Once enrolled in Medicare Advantage plans, switching back to Original Medicare can be complicated. If you want to switch back to Original Medicare and purchase a Medigap plan, you have to go through medical underwriting, which could result in higher cost or denial of coverage. In some states, Medigap plans are available outside of open enrollment periods, but this is not the case everywhere. Restrictions of care. Medicare Advantage plans often impose more restrictions on care compared to Original Medicare. Many plans require prior authorization for specific treatments or services such as surgeries, hospital stays, or cancer treatments. These restrictions are meant to control costs but can cause delays in receiving care and sometimes lead to denials for service deemed not medically necessary. Limited provider network. One of the most significant limitations of Medicare Advantage plans is the restricted network of providers. Unlike Original Medicare, which allows you to visit any provider who accepts Medicare, Medicare Advantage typically limits you to in-network providers. If you need to see a doctor outside the network, it will incur higher out-of-pocket costs. In some cases, the services may not be covered at all. This can be especially problematic for those living in rural areas or those who travel frequently. Plan changes and instability. Medicare Advantage can change from year to year. This includes shifts in provider networks, drug formularies, premiums, and coverage details. Insurers may withdraw from certain areas, leaving enrollees scrambling to find a new plan. These changes can create uncertainty and require beneficiaries to stay vigilant during open enrollment periods. Extra benefits may have limits. Medicare Advantage plans often advertise additional benefits, such as free dental, vision, and hearing coverage. However, these benefits can be misleading as they often come with strict limits. For example, vision coverage may only cover a portion of the cost of glasses, and dental plans often cap annual benefits at a low amount, which may not cover the full cost of necessary treatments. Additionally, gym memberships or fitness benefits may have time restrictions or other limitations. Out-of-network costs: if you need care outside of your plan's network, you may face high costs. Many plans have no cap on the amount you could pay for out-of-network care, and these costs can quickly add up. This is particularly concerning for individuals who travel or live in multiple states, as Medicare Advantage may not provide the flexibility required for those who need care while away from home. Overwhelming choices: while having multiple plans to choose from can be beneficial, a large number of available options can be overwhelming. Comparing plans requires careful attention to details such as premiums, network, coverage options, and provider availability. It's essential to carefully review all aspects of each plan before making a decision, but the sheer volume of plans can make this process cumbersome. Who is Medicare Advantage best for? Medicare Advantage may be suitable for those who are looking for lower premiums, especially if they are unable to afford a Medigap plan or if they missed the Medigap enrollment window. It can also be a good fit for healthy individuals who don't anticipate needing extensive health care services. Additionally, individuals with specific chronic conditions may benefit from specialized Medicare Advantage plans tailored to their needs. Who should avoid Medicare Advantage? Individuals who prioritize flexibility in healthcare access, travel frequently, or have complex medical needs may find Original Medicare with Medigap plan a better fit. Those who can afford the additional premium for Medigap coverage and desire more control over their healthcare options should consider staying with Original Medicare. Conclusion: Medicare Advantage plans provide a range of benefits, but they also come with significant limitations. The key to making the right choice is understanding both the advantages and drawbacks. It's essential to carefully consider your healthcare needs, lifestyle, and budget before enrolling in Medicare Advantage plans. By thoroughly reviewing your options and understanding the restrictions, you can make an informed decision that best suits your health and financial situation. Comment if you have any questions as it relates to the disadvantages of Medicare. Brad Williams, Frugal Finance. Thanks for watching. Hope that helps. See you soon.